Cyclosporiasis cases are here in Texas now, and so the question is, how worried should we be about this? We have updated numbers for you today with Tarrant County confirming a handful of cases this year. However, none of them appear to be linked to the national outbreak currently going on. Collin County has reported 2 cases since January, both tied to international travel. Denton County has also confirmed 2 cases that do appear to be connected to the national outbreak happening right now, but health officials haven't issued a public advisory because they still don't know exactly what is the cause of these infections. Cyclosporiasis can cause severe diarrhea, cramping, fatigue, and other symptoms that can last for weeks or even months. Pretty miserable. Obviously, we would all like to avoid that, but so much of this outbreak still feels pretty unknown. So to help explain what is going on, how much is confirmed right now, how worried we should be, we have Dr. Nicholas Mendrigal from Medical City Denton joining us this afternoon. Dr. Mendrigal, thank you so much for taking the time and being here with us today.
Yeah, absolutely. Thanks for having me.
All right, so we have 2 cases reported in Denton County now that appear to be linked to this national outbreak. Do North Texans need to be concerned about this, and if so, how much?
Nothing right now. This is a typical infection, like you said, we see pretty much every summer. Not unusual at all. There's typically several hundred cases nationwide per year. Right now, there's a slight increase in those numbers, but nothing out of the ordinary for what we usually see all summer.
Okay, so that's a little bit reassuring there. This is a parasite, as you mentioned, that we've dealt with before. It springs up in the summertime. What makes this situation that we're experiencing nationally right now different from what is usual then?
You nailed it a little bit when you said there's several states involved, I think up to 17 from what I read. Some states are reporting far more significant numbers of cases. The biggest issue is that we don't know where it's coming from. Normally, when we have these outbreaks, they'll identify clusters and they'll be able to identify the source of the infection, typically water or foodborne produce, things like that, and they can identify it, isolate it, and have people avoid it. So two of the unusual factors is it is a slight increase in the number of cases, but also they haven't done a very good job of identifying where they're coming from yet.
Yeah, it's kind of a mystery right now, and they're on the case, but nobody's been able to completely isolate that and figure it out yet. In the meantime, though, what do we do here? What steps should people be taking right now to protect themselves and their families? Because it sounds like a pretty awful thing to have happen to you.
For sure. As opposed to the last few infections that we've kind of dealt with and been through together, this one, the good news is it's not spread from person to person. It's always going to be food or waterborne. So an infected person has to spread it through one of those 2 things. So mostly through produces, lettuce, raspberries are kind of notorious for causing it. Washing your vegetables, rinsing them, hand washing, hygiene, all the normal stuff for infections, but especially if you're preparing food, not doing it while you're sick with any type of illness would probably be a good suggestion.
That's a good rule of thumb there. Can we talk about treatment for this? Because, it sounds so dire when we say that people could experience this, horrendous, these horrendous bathroom issues for weeks, even months at a time. What happens treatment-wise here if somebody does get this?
The upside with this, the other part is it's extremely treatable with one of the most commonly used antibiotics that we use on a daily basis. So the key is just identifying it and treating it. A lot of people with healthy and competent immune systems get better even without treatment, and so we don't even have to worry about it. Folks whose immune systems may be a little more compromised, or the young or the elderly, even if it's not directly identified with cultures or lab testing, we can treat it fairly simply with a week-long course of antibiotics. So that's one of the benefits of this.
All right, so there is hope out there for sure. Dr. Mendrigal from Medical City Denton, really appreciate you taking the time to answer the questions today and kind of bring some perspective to this for all of us.
You got it, absolutely.
Thank you.